Our reporter Sipamandla Goge is at the Royal Grounds in Pietermaritzburg. That's where the KwaZulu-Natal Health MEC is. And Lindsay Dentlinger is in Cape Town, the Health Minister briefing the media a short while ago. Sipamandla, I know you've been trying to get information about exactly where this patient is in isolation. What more can you tell us?
Authorities are not speaking in KwaZulu-Natal. We have tried the Premier's office. The Department of Health in the province says all questions should be directed to the National Department of Health. Health MEC in the province, Nomakuku Smelane Zulu, is meeting with the team from the National Department, the tracer team that has been dispatched to KwaZulu-Natal. We understand that the patient is originally from KwaZulu-Natal or is based in the KwaZulu-Natal Midlands region. Now, let me add that nothing is confirmed for now. Obviously, the authorities are not giving much away, but our sources have told us that the patient is indeed, according to them, believed to be from the Pietermaritzburg region. Hence, when he landed in the province from the King Shaka Airport in Durban, he came straight to this region in Pietermaritzburg. After a few days, he went to see his general practitioner, and then he went back home to go and be on self-isolation. We were trying to get a comment from the authorities. They are not giving us that comment. What we have for now in terms of the whereabouts of the patient, we are getting it from our sources. But I know authorities and the president are saying people of South Africa and KwaZulu-Natal should not panic. We drove from Durban to Pietermaritzburg. People were panicking. People are saying they were not really ready for this news, and there is panic in Durban and in Pietermaritzburg. I can confirm that because I've seen that.
Yeah. So, Lindsay, of course, we know what the President and the Health Minister said about panicking, but what else did the Health Minister say at this briefing when he addressed the media?
Well, he was asked the question whether it was necessary to ban South Africans from leaving the country, for example, sporting teams, and to maybe stop any events here with the Easter weekend coming up, and you're aware that people travel cross-country, and he said he didn't feel that it was necessary at this stage. As you point out, it was actually the Deputy Minister of Health, Joe Pachla, saying that you had to strike a balance between being vigilant and creating unnecessary panic. And for now, he is satisfied that this is an isolated case. They are well in contact with all the people this man has come into contact with. His children aren't going to school. His wife, they are at home, not allowed to leave until they have passed a certain incubation period. They've been tested regularly. So really the minister saying it's not at a point where we have to stop the movement of South Africans. We have to institute travel bans. It's just not at that point, and that we should just really stem from being overly panicked, and that it wasn't necessary to go to other public places like perhaps taxi ranks and schools and randomly test people. It was really not at that level that it was necessary to do such things in the wake of this first reported case here in South Africa.
And Sipamandla, of course, there are several facilities across the country identified to deal with this virus. Tell us about those in KwaZulu-Natal.
According to the Premier of the province delivering his State of the Province address yesterday, he said KwaZulu-Natal was ready for any eventuality, and he mentioned 4 public facilities in the KwaZulu-Natal Midlands, in Pietermaritzburg, in Durban, and in the northern part of the province. Let's listen to Sihle Zigarala explaining about those public health facilities.
We wish to assure all people of KwaZulu-Natal that we are ready to deal effectively with a potential coronavirus threat. We have placed on alert the following hospitals: Grace, Eddington, Ngwelezane, and Manguza hospitals.
Lindsay, let's end off with you. How sure is the minister that this can be contained?
Fairly positive, Shahan. As you pointed out, there are sites to deal with it. He also had doctors, specialists from the Institute for Communicable Diseases with him, and their teams are in KwaZulu-Natal tracing, tracking, monitoring those who might have come into contact with the infected patient. And also the minister saying that he's satisfied. He's gone through the actual numbers of mask protective gear at the hospitals. As we know, there's running running the risk of a global shortage, and he's quite satisfied that all those measures are in place to deal with any event of this one case spreading further. But for now, as I said, he's trying to guard against unnecessary panic, saying people should just be aware, follow those health tips that are being issued, and he's quite satisfied that it can be contained for now, and that the country's borders are doing what is necessary to test. The Portfolio Committee from Parliament on Health will travel tomorrow to do their own inspections, to check that screenings, etc., how that's all going to take place. They will be going to go check firsthand tomorrow as to how that operation will be followed up.
All right, Lindsay Dentlinger is in Cape Town. Sipamandla Goge is in Pietermaritzburg, of course, bringing us the latest on the story.